Welcome back, dear viewers, and our second guest of the evening is Dr. Hala Najeed, ophthalmologist and fellow of the Royal College of Glasgow. Dr. Hala, welcome back to Hala Kuwait. It's a real pleasure to have you with us tonight.
Hello, Muhammad. The pleasure is mine.
Yeah. So mostly when it comes to the vision problems and the vision cases you face with the patients, what are the most common, or what are the types of problems you mostly encounter with?
To make it simple, we have three main problems or vision problems. One of them is called myopia or short-sightedness, where you can see near objects but you cannot see distant objects. There is hypermetropia, which is the opposite, where the person can see far ahead but they have a problem with near vision. And the most common one, which we always hear about, is astigmatism, where the cornea is not very regular, so it refracts light in an abnormal way in different directions.
Definitely. We hear nowadays, Dr. Hala, about people when they have problems with visions. Mostly we hear someone recommending to them to do LASIK.
Yes, exactly.
Go and do LASIK. So we would like to know more. What is LASIK and how it is different from femto-LASIK also? There's another type of LASIK.
So to make it simple, LASIK is a very simple procedure depending on laser to discard your glasses. It can actually work for the three types of visual problems that we just mentioned. What is the difference between LASIK and femto-LASIK? The main difference is the LASIK depends on a surgical blade called the microkeratome, while the femto-LASIK totally depends on femto-laser, so there are no blades involved whatsoever.
Yeah, and the most common, is it like the patients prefers LASIK or femto-LASIK?
Actually, both of them work perfectly fine, but femto-LASIK is safer when it comes to patients with lower corneal thickness. So it can actually work for everybody, but it's more recommended for patients with low corneal thickness.
Exactly. So let's go back, Dr. Hala, to the problems or the vision problems you face when it comes to vision correction.
Yes.
Will you please tell us more about the procedures you take, like when it comes to vision correction?
Yes, as we just mentioned, there are several procedures. There is the LASIK, there is the femto-LASIK, and then we have other types of procedures called the PRK and also something called the femto-smile. The choice of surgery depends on several factors. One of them are the numbers of your prescription, so the numbers in your glasses. The second one is your corneal thickness. Both of those can be assessed before taking the decision and before recommending a certain procedure to you. To make it simple, PRK and femto-LASIK work for patients with low corneal thickness, while LASIK and femto-smile require a good corneal thickness and mostly reserved for higher errors or higher prescription.
Definitely. Well said, Dr. Hala. Now you already gave us an impression that we are walking at your clinic.
Yes.
And you explained to us. Well said. So
and I'm trying to make it very simple so everybody would understand.
Definitely. Well said, Dr. Hala. When it comes to femto-LASIK, let's go back to it a little bit, if you don't mind, please. When it comes to the patients, who's the best candidate to do femto-LASIK?
Yes, for sure we don't recommend any type of laser vision correction before the age of 18. So the patient has to be at least 18 and above. Number two, the eye has to be sound, so there are no other diseases affecting the eye like glaucoma or diabetes or cataract. Also, the corneal thickness of the patient has to be within the normal range, above 500 microns. The last thing is the prescription of the patient or the numbers in his glasses. So we have to assess this also. It has to be within a range from like 0.75 up maybe to -15. This is the range that LASIK can correct.
Definitely. And also we didn't forget, the viewers, the most common question when it comes to you wondering after taking any procedure or doing anything is the expectations. It's one of the most frequently asked questions, Dr. Hala. So when it comes to expectation, what do we expect after laser complications, like when it comes to the recovery period and complications and side effects?
Yeah, most patients actually are worried about possible complications, the recovery period, the downtime that they need to take from work. I want to reassure everybody that LASIK is a very simple procedure. The number of complications is very low. The downtime is mostly 1 week. You can experience some light sensitivity after LASIK, some dryness, but those symptoms will go away with proper treatment within a week or two.
Definitely. Previously, on previous episodes on Hala Kuwait, Dr. Hala, we discussed the definition of lazy eyes and
Yes.
What is exactly lazy eye. So when it comes to a lazy eye, can't be treated with LASIK?
Unfortunately, LASIK cannot correct lazy eye. What is lazy eye exactly? To be very simple and quick, it's an eye that doesn't have any organic problems, but unfortunately this eye cannot see properly for a number of reasons, and this was not corrected before the age of 6 years.
Exactly.
So if it's not corrected when the patient is 18 and he wants to do LASIK, if he's diagnosed with lazy eye, we have to tell him that the LASIK will not correct the lazy eye.
Definitely. Well, thank you so much, Dr. Hala, for being here tonight with us on Hala Kuwait and sharing this really valuable information with us.
Thank you. The pleasure is mine always.
It's always a pleasure. The viewers, we just had with us Dr. Hala Najeed, ophthalmologist and fellow of the Royal College of Glasgow. Let's go now and check our third report of the evening. Don't go anywhere. We'll be right back. Stay tuned.